So naturopathic medicine is based on several principles, and I think I should probably outline some of them. The first one is do no harm. It's no good if you're worse when you go to the doctor, obviously. The second thing is you look for the cause to the condition. You want to treat the underlying problem as opposed to just putting a Band-Aid on it. In Oriental medicine, they call it treating the root instead of the branch. And we can probably come back to that a little bit. The next thing is that makes naturopathic medicine a little bit different than mainstream medicine is that we really honor and respect and observe the healing power of nature. In Latin, it's called vis medicatrix naturae. And so we believe that your body is smart. And you are smarter about your condition than the doctor sitting across the room in 5 minutes telling you about your problem, and that you have an intuition about it. There's also an old saying that if you listen to your patient, they will tell you what's wrong, but you can't really do that in 5 or 10 minutes. It takes longer to figure out what's wrong with people, and it's harder to fix them than it is just to palliate them. So the healing power of nature is really important. Closely related to that is to deal with observation. So you observe your patient, you observe their processes, you observe what's going on, and you remove what's called obstacles to the cure. So, you know, if you're having troubles with anxiety and insomnia and you're drinking 3 triple lattes a day, I might be suggesting maybe you shouldn't do that as opposed to just taking, you know, Ambien for your sleep or Xanax for your anxiety. So that's a very simplistic type idea, but, you know, the idea is you move the obstacles to the cure. The other thing that naturopathic medicine focuses on is treating the whole person, and I don't have to talk about that because it's pretty obvious now, but when I went to school, they didn't talk about things like this. But first of all, that, you know, we're very complicated beings, and that mental and emotional and physical and spiritual and lifestyle things are all applicable, and they all need to be in a state of balance. We also want to educate our patients. The literal meaning of doctor is drosera from the Latin, which means teach. So we educate our patients, and that's really important. And most of the patients, you know, they come to see me because they have an understanding that there's something more, or they want something different, or they've been told they're going to die and I'm their last resort. So that's pretty much what I see. So education is key. Now, some people just want to remote a case of beer and some Percocet for their back pain. I've seen those people too. When I worked at Alaska Regional Hospital, you know, a lot of folks, they couldn't care less about their food allergies or their nutritional status. They just wanted instantaneous relief. As a rule, most of those people, they just don't want to come in to see me. So the people that come to see me, they really want to get fixed. So we educate them and try and teach them how they can take care of themselves as far as their medical ailments. Prevention is also important, and that's a real cool area now because there's a thing called genomics, which basically says your genotypic expression. That's sort of how you choose to live your life. We used to think that if mom and dad had cardiovascular disease, hypertension, or, you know, a heart attack, that we were destined to have the same thing. Well, now we find out that if you live your life differently, you're not going to have those things, and they can prove that out with genotypic expressions in certain high-end testing where they check your genotype. For example, for cholesterol, some people that have high amounts of cholesterol, they tend to have a genotypic expression that we've seen with you know, people that tend to have high cholesterol and blood lipids. So, you know, prevention is really important. That's a really cool phrase you might come across is the genome, the human genome.